The end problem of asthma is narrow airways, usually because of some inflammation, and much of that inflammation is related to allergy. Some of that allergy is inherited. So inheritance, allergy, coming across a specific trigger for that allergy, some of those things are avoidable with good care. Some of them we have to live with, some we have to work with to ease off.
Some of the main triggers were in springtime. There was lots of sort of pollen or hay that was in the air, and that had sort of set me off.
The commonest allergy by far in Australia is house dust or house dust mite. We can't do much about that unless we go back to living in freezing Scottish castles. We have a humid environment, efficient humid houses, and dust mite love that. There are a range of other allergies from grass, funguses, various moulds, and they will affect different people living with asthma in different ways, but almost everybody in Australia is house dust mite allergic.
You've got to be a bit careful about this house dust mite story though, because it's led some parents to go mad cleaning their houses, ripping up carpets, covering everything in plastic. If you want to do that, fine. But the evidence is that it's not necessarily worth the effort because it's impossible to remove all sources of allergy. And perversely, one study even showed that feather pillows had a lower asthma rate than foam ones. In the end though, asthma is a combination of environmental and genetic factors.
The genes and environment are interesting. When East and West Germany came back together, there was more allergic disease in the clean, modern, wealthy West Germany than there was in East Germany. So same genetics, different environment, different outcome. There are many differences between East and West Germany, and these have been speculated on by experts. Larger families, you're better off born towards the end of a large family if you want to avoid having asthma. Again, it may be a bit of affluence, warmer houses, less humidity in those houses. It may be something else altogether. Smoking is another important factor, both smoking in pregnancy in terms of the future likelihood of asthma in the child, and active smoking plus passive smoke exposure influences the likelihood that asthma will develop and be severe.
I used to find that if I got exposed to cigarette smoke, for example, that would bring on the coughing. And some other triggers, you know, sometimes pollens in springtime, that sort of thing. But I didn't really realise that those were triggers until after I was diagnosed with asthma.
The pet story is very complex, and frankly opinions have waned over whether exposure in early life is good, bad or indifferent. I don't think we can have a particular view at the moment as to whether we should be exposing little kids to small animals or avoiding it.
Another asthma trigger to be aware of in some people is aspirin. So, you get the right diagnosis, you know what triggers to avoid if you can, and you get the right prescription from your doctor. But that's not worth much if you don't know how to use your inhaler or puffer properly.
So using your puffer correctly is really important because that determines how much of a dose you get. If you think about it as a tablet, if you'd only take half the tablet, you'd only expect half the dose. And you can see that really clearly. With a puffer, you can't see clearly you're only getting half the dose, but if you don't use it correctly, you may be only getting half the dose and hence half the effect.
Now that you've got your medicine, we're just going to have a quick chat to make sure that you're clear about a few steps to ensure that you're using it properly and to make sure.
It's a good idea to get someone to help you learn how to use your puffer, and sometimes you might want to do that not just the first time you use it, but perhaps every time you go back to the pharmacy. So the pharmacist is trained in showing you how to use your puffer.
Unscrew and remove the inhaler cap.
Similarly, your doctor can show you how to use the puffer.
Then rotate the red grip on the bottom one way.
The advantage of doing it at the pharmacy is they'll be giving you a new prescription of your puffer, so you'll have it there to try the one that you're using.
And that's loaded your dose now, that's ready to go.
So I'd really recommend people do that. When they get a new puffer, they trial it with the pharmacist there, and if they're not sure that they've got it right, they go back and have another go, because all pharmacists are really keen to make sure we know how to use our puffers properly.
Now keep the turbihaler upright, and as you do that, rotate the red grip on the bottom one way and back again.
It's important to realise that asthma in children is different from asthma in adults. Childhood asthma can be more often episodic, and that means they can rely on the blue puffer a bit more than adults, but not always, because if they need it frequently, they need a preventer too. But since asthma in childhood is so common, how it's treated at school is vital.
It's very serious. We have 30 students within our school that have asthma, as well as quite a few staff members. We know that the asthma that the students have at our school ranges from mild to severe, but we know also what is something that is mild at the moment can easily turn into a severe condition. So we treat it very seriously. We have a plan in place, we have a policy in place, and we have the professional development. We have a medical alert poster that we put the information on, including students' photos. So that's disseminated throughout the whole school so that all staff members are aware of what medical conditions students have, including triggers, symptoms, and how to manage a student's asthma attack should they have one. If we go off-site, we ensure that we take students' medication with them and that we take the medical plans that they are taken as well, and we ensure that teachers have a mobile. In here we have a puffer. The health curriculum itself, or the health syllabus, actually has information in there, and that's taught to students throughout the year levels. Many of the students at our school actually self-medicate, so the middle to upper primary students actually are able to manage their own asthma condition quite successfully. It tends to be the junior primary years where we have to monitor that. That's it. They're involved in sports. Many of our students that have asthma actually have their medication before they come out to do sports.
The key messages then are, you've got to get the right diagnosis, and that means using spirometry. You've got to get the right medications, and if you're using your blue puffer too much, your reliever medication, you need a preventer. You need to treat your asthma. And whatever puffer you use, you've got to learn how to use it properly. And it's important to get a written asthma action plan from your doctor so that you know what to do if things don't go well.